good afternoon, ladies and gentlemen. As Rupak in the last session repeatedly mentioned that we are getting very delayed. And so you can understand we are still more delayed because it is the next session. This topic of this particular session is something slightly different. And that is connection, how Make in India and healthcare. Why Make in India comes in healthcare discussion? For the simple reason that it is a policy of the government now that to improve healthcare, we need more of device, more of medicine, affordable, accessible. Also, this must be made in India. And healthcare is one of the major areas where this is a focus area, along with a few others. Healthcare is a focus area for Make in India initiative of the government of India. A lot has been said about healthcare, so I won't repeat anything to say about this. But the only point I would like to mention that today we lead a very stressful life. We cannot get out of that. But from stressful to stress-free, it's only possible through proper holistic hygiene and healthcare. Without that, a nation cannot go ahead. So we have, a lot of us have, in this country, there's the expansion, big expansion on healthcare, but health insurance. But more than that, we need really health assurance. And healthcare and preventive medicine only can give us the assurance. If you look at some basic statistics in India, manufacturing to GDP ratio is about 16–17%. And it is targeted by 2022 that it will go up to 25%, the percentage of manufacturing. The part of medical devices, which is manufactured in India, is only 0.2–0.3%. Now, I don't see that as an obstacle. I think that's a big opportunity. Because there is so much to do where the field is far from saturated. In fact, it's waiting for all investors to invest and make in India program successful. And this, the market for wellness market, as it is called, is going to approach very soon a figure of 1 trillion Indian rupees, which is a hell of a lot of money. The medical device today is around $5 billion and is targeted in India to be about 30, which is a huge number. Today, it is also important for another reason that diagnostics have become an essential part. We mourn, actually, the older age people, they mourn that earlier days, somebody came and take your pulse, sat with your pulse for 15 minutes and then diagnosed everything. Today, no way that you can go like that. And diagnostic means what? Diagnostic means more device, more electronics, more hardware, more software. Unfortunately, this is today very, very import-driven in this country. So what is needed actually to see is how we can turn the table and make it later on, first the need of this market in the country, but later on how to export it. And that's going to be a big challenge. We have heard about telemedicine being talked. Telemedicine, a lot of hardware has to be manufactured for telemedicine and also software. So all these things show the importance of Make in India as far as healthcare is concerned. And the technology, when it comes with things which have to be manufactured. And that is, it will increase access, it will reduce burden, reduce load, it will make delivery much easier, clinical outcome much better, and with quality. So that's why the equipment is so necessary. Just to give you one example, GE, which is one of the largest engineering conglomerate in the world, I don't know whether you are aware of this, they have set up a base in India, and they have already started exporting to all over the world. They are based, actually the company is from US. They have started exporting to all emerging markets at a very low cost medical devices, which we were importing earlier. Now with the same thing are made here and with a much lower cost, and their target, they think that they can make such things average 40% cheaper, and they have 10–15% of the global market in another 4–5 years' time. So if they can do it coming from US, There is no reason why we can't do it even much better. Biotech is another field, pharma is another field, where I think the people, our panelists will talk on this. There is a great need. There is a great need for all this, but scarce resources. We have scarce resources. Solution has to be affordable, resilient, reliable, easy to spread around, fast growth, vital, touching lives of all people. And that's the most important thing. The future seems to be also very bright of such equipment, healthcare equipment. I mean, if you read today what are the novel techniques which are coming in healthcare, it will look like fiction almost. Radiosurgery, optical scanner, no intervention, no invasive technology, but you can measure your sugar, make many surgeries without any problem, without being invasion, without making it invasive. If you have a very bad headache, migraine, you don't have to take a tablet. You have to only stop by a procedure here, you can stop the nerve from taking it to the brain. And like that, it sounds like almost, as I said, fiction. And all these will need a lot of things. And that has to be made in this country. And that's why healthcare is so important for Make in India movement.